recognition. We got a lot of global recognition from, the World Bank, Bloomberg, applauding Nigeria for taking this step. And I think it's also very important to shed some light on the specifics of the medium of the SSB tax in Nigeria. So it was introduced via the Finance Act, and it was phrased as a levy on carbonated drinks, and it's a 10 naira per liter tax. I'm sorry, this is not working. Next slide, please, if you can just, next slide. Exactly. So it was passed through the 2021 Finance Act, and the act states that it's an excise duty tax on non-alcoholic, carbonated, and sweetened beverages, and it shall be charged at 10 naira per liter. So it's a specific tax. I think we've all learned a little bit more about the various modes of taxation and tax structure from DGI. Next slide. All right, so this is my last slide before I call up my colleague, Ome Bongos. So with the Finance Act has a lot of limitations. And while we applauded the government at the time for taking this step, the 10 naira per liter tax at the time and right now is too low to yield positive public health outcomes. I know a lot of conversations has been ongoing about, inflation and the cost of, sugary drinks, and how the tax has really affected, reduced consumption or the lack thereof. We also heard from DGI how the current Nigeria's current SSB tax is low compared to globally recommended standards of 20%. So that's the first limitation of the current SSB tax. And secondly, like I mentioned, if the tax is higher, then obviously consumption would be lower. And that's really the outcome that we want to see as public health advocates. And thirdly, the Finance Act makes no provision for earmarking. We've heard a lot of conversation about earmarking in the room today, and that's something that we have been calling on the government to consider. We understand that, earmarking of funds in Nigeria is very complicated because of the tax structure in Nigeria. We know that revenue goes into a singular pool. However, we know that it can be done if the government sees reason on the benefits of earmarking of the tax and how it can be used to increase healthcare financing in Nigeria, which is abysmally low. And lastly, the Finance Act is a medium that leaves the SSB tax very vulnerable. And I'll tell you why. Every year, the Finance Act gets reviewed. So if you remember, I mentioned that since the tax has been passed, we have been constantly, calling for a sustainability, because it being in the Finance Act and the Finance Act being reviewed every year leaves it open to various amendments or even a possible halt in taxation. We heard from Dr. Ghaffar about how the Finance Act at some point had been halted. And that also leaves stakeholders a little bit concerned on the feasibility and viability of the SSB tax in this particular financial instrument, being the Finance Act. So as Gatefield and NSR, we've been asking ourselves, how do we ensure that the tax is sustained? How do we ensure that the tax is increased and also takes account for the inflation that's going on in the country? And we have decided to try to progress the tax through legislation. We are working with DGI, other stakeholders, to put together a legislative bill that accommodates all of these concerns. And my colleague, Ome Bongos, is here to walk us through some critical aspects of the bill, and would really like to hear your input, your thoughts on the feasibility and the viability of this bill, because we really want it to pass through the National Assembly, and we're just here to gather your thoughts. Thank you.
All right, thank you. Good afternoon, everyone. Thank you very much, Shirley, for that introduction. My name is Ome Bongo-Sikwe. I'm a communication specialist at Gatefield. And as Shirley explained, we're going to talk about the legal framework possibilities for SSB taxes. And it's really great to have been in this room and just to hear the work that has been going on towards strengthening tax policies, healthcare tax policies in Nigeria, fiscal tax policies, and particularly thinking about some of the outputs from this meeting. One thing that we really want to at least begin to start to crystallize is, what will an SSB legal framework look like? What will a pro-health tax policy framework look like? And I know there have been, lots of comments, plenty of feedback about, should the tax policy even stand alone as an SSB tax policy? So, but I want to invite us, as I'm presenting, to think through some of these components that I'll be presenting. Thankfully, we've heard quite a number of instructive things that will already start to go into this framework that I provide. So I'm looking forward to the feedback and discussion that will follow this session. So I'll start with the framework development process. When I was listening to Chibuike speak from NTCA during the panel, he talked about how it took 10 years to go from becoming a signatory to the FCTC to getting the Tobacco Control Act passed. And what he didn't tell you is that it took another 4 years for the regulations to be passed, the 2019 Tobacco Control Regulations, for the acts to even start to be enforced physically. So it's a process. But one thing I'm glad about now is being in this room is the beginning of history. If we think about the work that has gone into SSB tax legislation, SSB tax policies, and the work that lies ahead of us. So it's interesting to think about being a part of history. And so this is the framework development process that has started with the help of DGI. Again, we started with a review of the implementation status modalities, much of which has been provided by the DGI research team, particularly the challenges to the current 10 Naira per litre tax, which Shirley has given us, and then the framework further guided by the recommended policy design from the WHO Global Report. The WHO has an excellent manual on the use of SSB taxes, on how taxes should be designed, the frameworks, and it's something that we should all take some time to study. And finally, stakeholders from public, private, and civil society organizations being engaged. And we're still part of this process. This process of engaging stakeholders is what we are currently a part of now. So this is an ongoing process that we are currently developing. So even though it's listed in the past tense, so to speak, it is an ongoing present tense process of which we are all a part. Next slide, please. All right. So when thinking about a legal framework or a health tax policy, it's very important to define what exactly we're talking about. So what exactly do we mean when we say sugar sweetened beverages? Is it just Coke and Fanta? Is it just soft drinks? Is it just packaged juices? These terms are very crucial to define. So SSBs, non-alcoholic beverages containing sugars. They consist of a range of beverages, not just the ones that we are familiar with, not just soft drinks, but also fruit juices, packaged juices, some things that are usually marketed as healthy, but contain copious amounts of sugar, liquid and powder concentrate. So we think about juice boxes that children take to school. We also think about flavored water, energy, and sports drinks. Again, commodities that are marketed as things that will make you healthy, make you perform better. Ready-to-drink teas and coffee, sweetened teas in sachets. Those are becoming increasingly popular. Flavored milk drinks and sweetened iced teas. And we also talk about free sugars. Free sugars are sugars that are added to food and beverages. They're added to food and beverages by the manufacturer or by the producer of these products. So when we talk about sugar sweetened beverages, as we define it in the bill, this definition will be all encompassing so that there is no mistake, so that nothing slips through cracks and then goes out to the public. So it's very important to define these terms. And of course, for those people who are familiar with crafting legislation, the SSB then, wherever it appears in the bill, will then encompass all of these items that are contained in the definition. Next slide, please. All right, so what would be the objectives of this health bill? the big goal, the big objective of this would be to enhance public health. We've talked about that, to reduce the prevalence of non-communicable disease, the rising prevalence of non-communicable disease. Nigeria currently ranks #1 in diabetes prevalence in the world. I want to in Africa. Diabetes prevalence in Africa, it's in the world. And when we think about diabetes, we're not just talking about, it's not just type 1, type 2. Now, type 2 diabetes accounts for more than 90% of diabetes cases in Nigeria. So when we think about diabetes, it is the diabetes that comes with modifiable risk factors like consumption of SSBs. So we're thinking about reducing NCD prevalence and promoting healthier dietary choices. And this framing of the objective is very important because it's a pro-health tax. So you notice that the big goal there is not necessarily about generating revenue, but primarily about reducing non-communicable diseases and improving public health outcomes here. So the objectives flowing from this goal now to encourage healthier diets by reducing the consumption of SSBs and creating healthy food environments. What's a healthy food environment? It is a society where consumers are guided in their choices by what to buy. So they know that I don't have such easy access to products that will harm my health. Instead, my access to healthful products is increased. It's also to create a sustainable SSB taxation structure. We've already talked about the limitations of the Finance Act and the limitations of the current SSB tax. We want a health taxation structure that is sustainable and truly effective. And finally, to generate revenue. So we'll come back to revenue here, but we're framing this primarily as a pro-health tax to fund health programs addressing NCD's prevention and care. Next slide, please. All right, so what measures are we proposing in this bill? What would be the provisions of this bill as we envision it? So we are proposing a tax of 130 naira per litre on sugar sweetened beverages produced in Nigeria or imported in Nigeria. We understand that there are many SSB companies popping up across the country, very popular and very well-known beverage brands. And again, it's important to define this in the bill, to be as specific as possible when we're defining this. And I know that some of us might be wondering why this figure, 130 naira per litre. Well, CAPA is not in the room, but CAPA recently did a modeling study. And just to summarize, that modeling study found that the most effective tax rates based on the current price of SSBs in Nigeria that will start to encourage the reduction of consumption is 130 naira per litre. Now, this can be expressed as a percentage, but we're proposing here in the bill 130 naira per litre. And given the current realities of the economy, we know that we are living in the throes of inflation. So the bill will further propose a review of the SSB tax based on inflation. So the tax rate will be reviewed to take into account the effects of inflation. And we're also proposing an excise tax, a specific excise tax, separate from existing taxes, separate from the VAT, company taxes, company income taxes, and specifically targeted at SSBs to deter their consumption for health-related programs. And we're also proposing that all taxes collected under the bill have to be remitted to the ministry. Now we have learned that all the taxes currently collected are remitted into a single account, but we are proposing under this bill that they be remitted to a Ministry of Health under a fund to be used to prevent diseases. Again, we're reaching for the stars here. Okay, but this is what we are currently proposing. All right, next, please. So how will the tax be administered and enforced? What are some of the provisions that we are proposing for its administration and enforcement? And again, it's one thing to pass a bill, pass a policy, but another for it to be enforced effectively to see the outcomes that we're really looking for. So we think about administration. Responsibility for enforcement of the bill will fall on the FIRS. And thankfully, we've heard from the FIRS tax policy director here for locally manufactured SSBs and Nigeria Customs Service. But we have been corrected at this meeting, to understand now that customs is solely responsible. So whether the SSB is manufactured in Nigeria, whether it is imported, customs will be solely responsible for collecting it and at the point of manufacture. So that's how excise taxes work. And so we will have to amend this, before we produce a next draft. And we're proposing that the agencies will be tasked with collecting the SSB taxes and ensuring the proper remittances. And we're also proposing penalty for non-compliance. It's important to impose this because, again, it will strengthen enforcement. So penalty for 1 million naira who are proposing for non-compliance for individuals and for corporations, fine 3 times value of the SSB that constituted the cause of action and suspension of operations. Again, this is what we're proposing. They might seem stringent to some, or perhaps to others, not stringent enough. Next slide, please. Next slide, please. Right. Regulatory oversight and accountability. We've heard quite a bit about that. Accountability, efficiency. So how would we ensure that there is regulatory oversight and accountability for this legal framework, this bill that we're proposing? So it's important for the Ministry of Finance, to regularly review the tax rates. Again, we talked about that. Regularly review the tax rates based on economic inflation, and so that the tax is not undermined, so that it is not watered down. Right now, we're facing higher prices, and this without having the SSB taxes reviewed, it can open room for the industry to make arguments about the effectiveness of the tax. So it's important for these taxes to be constantly reviewed, constantly monitored. And it's also important for a report of tax implementation to be provided. Right now, the 10 naira per liter tax, there is no data available. When Abdurrahman was giving his presentation, he said there's no data available on how much has been collected so far. It's hard to get that data. So we need to know precisely how much has been collected. And so we're proposing that there would be a publicly accessible annual report made to the National Assembly Legislative Health Committee, detailing the remittances of the SSBs paid into the Federal Ministry of Health account or into the account, whatever account SSB taxes are paid into. There must be a report detailing this so that it's helping data collection. It's helping decision-making even, because it's hard to make decisions, real evidence-based decisions, if there's nothing on which to base it on. Your work will be arbitrary and it will run the risk again of being undermined. It's also important that the companies who are paying these taxes, so in addition to the customs who's collecting taxes, the companies that are paying the taxes to provide reports of how much they have remitted. It should form part of their own financial reports, really, and make these reports available to the Federal Inland Revenue Services or Customs, detailing these quantities. And finally, Ministry of Health, as a regulatory ministry, mandated to prepare and submit its own annual report to the Legislative Health Committees of National Assembly, detailing how it has used the remittances of the SSB taxes paid to the ministry. And again, this will be subject to how the SSB taxes are collected. Will the taxes truly be remitted into or directly to the Federal Ministry of Health? Probably unlikely, but these are some of the propositions and this is some of the feedback now on this framework that we expect to receive after the session. And finally, next slide. Yes, so what are the next steps now? Next steps, this framework has been presented, very skeletal, very draft version. We will need to review the framework, take into account our experiences, the research that has been conducted, findings from surveys, findings from studies, and use it to review the framework. Also use economic realities. What is truly the political economic reality on the ground in Nigeria and include that as we review the framework, and then convert the reviewed framework into a draft bill, and again, organize a workshop to review the draft bill and present the draft bill to the National Assembly. It's quite a process. It's very neatly presented here, but it's quite a process, and we have started the process. We have started the process, and as we put our thoughts into it and our experience, we trust that, which we can truly see the passing of pro-health tax legislation, the comprehensive SSB tax legislation. Thank you. All right. So our session is supposed to include feedback. What is originally on the agenda is group work, but we don't have time for group work. And the purpose of the group work really is just to get feedback on the framework that's presented, because this is what is going to be turned into the beginnings of a bill. And so we'd like to hear from us. We'd like to hear from you. That it's already clear what changes, what amendments need to be made to this draft. Again, because of the comments from the FIRS the director who was present here, but based on what has been presented and your understanding, would like to present feedback so that we can start compiling that and beginning the process of reviewing the framework, right? So we'll welcome questions now, questions and feedback. Yes, sir.
Well, thank you very much for this presentation. I'm just wondering, this 130 naira per liter suggested, well, I think we are jumping from 10 to 130. It looks like a big jump that will be very difficult to accept. Or is it in the context of the dollar that is changing? Because 130 per liter, even itself, some of these sugar products are not even 130 per liter. So that's my worry.
Right.
So yeah, thanks for the presentation. I think I also share, in the concerns that the earlier speakers said, which is about the 130 naira. And of course, you are the expert, right? You are the ones who are, have taken upon yourself to, to develop your skills in bill development and so on. But otherwise, I would say that, why don't we go with percentage of the manufacturers, the cost of that's we can talk about retail, we can talk about manufacturing cost of the products. I think that would be more, and it's easier, right? Because we're just talking about percentage. 130, you might look at it as big money now, but I know that in the early 70s, they said that Joe car was sold for 4,000 naira. So if you look at it from that perspective, it makes sense that you just go with percentage rather than actually being specific about the amount. I just want to also point out that it's just not possible that anybody would pay any money to the Federal Minister of Health and Social Welfare. That we have to get it clear. The only way that can happen is if there is amendments to the Nigerian Constitution. That would be a Herculean task. So we better just begin to think of how that money will eventually be remitted to the healthcare to the healthcare sector, whether it is the National Health Insurance Authority or some kind of health programs and so on and so forth. That would be a better way to think about it. Thank you very much.
All right. Thank you so much for that feedback. All right. So if there are no more questions, I'll just respond to I think it's Professor Akonde. Yes, so with the 130 naira per liter, as I mentioned, that was the outcome of a finding of a modeling study recently concluded by CAPA. CAPA is a very strong advocate of SSB taxes, also involved in tobacco control advocacy. And the figure was really the outcome of, modeling how much would be, so two things, the most effective tax rates to discourage SSB consumption, and also the effective tax rates to yield a certain amount of revenue that would truly be, attractive to the government at this point. I think they found that at this tax rate, it could yield up to 90 billion, 90 billion naira or so. But the suggestion of percentage has come up, and it does seem more feasible. Again, thinking about how flexible, the quality, the value of the naira is here, and so it's possible to translate that more sustainably because we would be actually painting ourselves into a corner if we limited it to 130 naira per. So it was highlighted there because that is the most current research that we have. And, again, just because of the rate of inflation, that 130 naira per liter might actually be a lesser percentage now, today, than it was 2 months ago when that research was released. So your feedback is very well received. Thank you. President.
Hello, good afternoon. Thank you very much for the presentation. So you mentioned when you started that the major reason why you're passing the bill is to ensure less consumption of those beverages and, in turn, make sure that people live healthy lives, right? So I want to ask that, did you also put into consideration the sentiment behind people actually buying this product in the first place? Things like, say, for instance, even if you increase, say, the tax obviously is going to lead to increase in price, and maybe people wouldn't want to pay for it, right? But we've seen currently right now the spike in prices of things, and people still buy regardless, right? And also for the fact that if you take a use case of somebody that is used to taking these beverages, right? It's usually a situation of it's a cue that leads to an action for them, which the cycle leads to a habit, right? So which means on a hot afternoon after being stressed, and the only thing that comes to mind is, oh, let me take a chill Coke or something like that. In that regards, having the price higher, I don't really think that would really, really solve the problem that, we are hoping to solve. Have you thought about, anything around that problem, basically? Thank you.
All right. Okay. I'll take one more question before I answer you, and then another question.
Yeah, thank you, presenter, for that good presentation. Just to draw our attention, I'm sure your presentation is to stimulate discussion, and beyond this, we'll take it over. So if you could share this draft for us to make meaningful contribution to it, share the draft for us to make meaningful contribution. Then I want to propose, in alignment with what others have said, we need to be very focused and very deliberate in the way we approach this. One, politics of taxation is clear. We all know that one. If you check the fiscal bill, which is usually rolled out annually by the Federal Ministry of Finance, it usually pushes 3 items at a time, traditionally. Alcohol, tobacco, and the SSB has joined. So each time they are pushing this thing, they don't isolate. So we need to lean towards that kind of thinking. Then 2, we need to go with proportion. Instead of giving an absolute number, we need to go with proportion, because proportion will take care of what happens in the market's fiscal space over years. So these are the things that I want us to look at. Then 2, are we focusing only on specific excise tax, or we are also adding ad valorem to this? So these are the issues, because if we check for tobacco, the ad valorem is there, even though we have not reached we've not even reached the ECOWAS recommendation yet, which sets it at 50. In the long run, with 150% for ad valorem. So I would suggest we look at the 2. If we are going for ad valorem and specific mix or hybrid taxation, then we'll look at it and go with proportion. I would suggest that way. But meanwhile, please share the draft with us for us to make meaningful inputs.
All right, thank you. So before I take another question, let me just answer these 2 questions. So your question on how are we considering the other aspects beyond price? So the other factors that that encourage the consumption of SSB? And that's a great question, because Dr. Kola made a point similar to that earlier on. So when SSB tax advocacy is in full swing, at least based on my advocacy experience, and when SSB taxes are introduced, when they are publicized, when there is education and communication around it, SSB taxes have something called the signaling effect, meaning that it is not just the effect of raising the taxes that causes people to draw back and say, it's too expensive. People who have money will not blink. They will still be buying the cartons of Fanta and Coke if that is what they prefer. But it is the accompanying components of the advocacy. And what am I talking about? I'm talking about communication, health education, those things that make people stop and ask. Why is there a tax on sugar sweetened beverages? Someone was saying soft drinks don't seem dangerous because it's not hard drink. But an SSB tax will make you stop and think, why precisely is this product being taxed? Why is it lumped in with tobacco and alcohol? And the accompanying behavior change communication messages, media advocacy, digital advocacy, in fact, the thing that will truly lead to, in addition to population-wide behavior change or population, change, is the education and the asking of questions that accompanies SSB tax advocacy. So people are now being made aware that this tax is being levied because, not just because we want to make money, but because we want a healthy population. So the drink might be fizzy and bubbly and it might be very sweet in your throat, but what effect is it having in the long term? Those are the questions that the whole advocacy process brings up. So it's really not in isolation. Advocacy is never just in isolation. It has to come, and indeed it comes, even with public awareness. Mainstreaming the knowledge of SSB taxes will also mainstream the knowledge that SSB consumption is harmful to health. And so, all right, so I did not write down the questions, but yes, having these slides available, it's something that, so what we're planning to do is a workshop, an actual review session, a virtual review session. I hope that as many people as possible can be present at that review session. So my question to that answer is, we will not be sharing the slides now, but at the review session, perhaps prior to that session, we can share an updated version so that everyone has a clean version to work with at the review session. And the other question was on, sorry, specific taxes. Yes. So, okay. So excise taxes. So excise taxes now are, with regard to the outcomes that we're looking for, excise taxes are for SSBs are currently, recommended. Taxing SSBs, for instance, by volume of sugar that is contained in the drink might encourage the industry to reformulate, meaning that they will say, oh, this used to contain 15 grams of sugar, now it contains 12 grams of sugar or something. And so people, again, might be misled. The point is, we're looking for healthy populations. And so excise taxes are the best in terms of the health outcomes that we're looking to attain. I know we don't have so much time. We really don't have time. So there was one hand. Yes. Okay.
Thank you, Ome and Shirley, for the presentation on the SSB tax bill. It's very comprehensive to see. I just had a very quick question around the public consultation, the extent of that's required for these sort of bills to be passed, how that was mobilized. Do you have a little bit of input on that, please?
On how the public consultation happened.
Public consultation, yes.
Well, it was a process. I think Dr. Gapa can also speak to that. It's a process of involving stakeholders. So Gatefield has been involved in SSB tax advocacy for a number of years now, and a lot of the advocacy that we did, riding on Honorable Minister Zainab Shamsuna Usman's political will in 2021, led to the passage of the 10 naira per litre tax in the Finance Act. The NASR coalition really is a group of 13 organizations now, 13 health-focused organizations that are advocating for this pro-health taxes. So we've had a number of consultations over the years, and meeting with DGI Consults has helped us to get to this point where a draft bill framework is being considered. So this is the long story short version of it. Okay. Dr. Gafar, do you want to add? Yes.
So just quick thing to add to your question. The fact that we are discussing here today is part of the consultation because we have a lot of stakeholders here. And just like Omei said, so part of the inputs they were actually informed by the key informant interview that we've done around health and policy analysis for health taxes. So one way or the other, input of several stakeholders is being inserted. But don't forget that it has not even gotten to the level of being presented at the floor of the National Assembly. And when that is done, there's going to be a public hearing where different stakeholders are going to be invited. But what is important to do is to get prepared before it gets to that public hearing. Because when it gets to the public hearing stage, a lot of stakeholders will be more interested. A lot of people from the industry and people that are fronting from industry will be part of it. So what is very important is for us to be well prepared to anticipate the question and obstacles ahead of time and prepare for them. I think that is what is very important to say it through. Thank you.
All right, thank you so much, Dr. Gafar. Any more questions? Any more questions? Probably not. I know it's lunchtime, so I'm going to hand over to Ibim. Thank you so much, everyone.
Thank you very much, Omei and Shirley from Gatefield. We will now invite Professor Akonde for summary of key takeaways, closely followed by Sekinat Sanusi, who is part of the Policy Analysis for Health Taxes project. Professor Akonde is our Senior Policy Analyst on the project. Welcome, sir.
Thank you very much. All protocols duly observed. We prepared a 2 to 3 page summary, but I rubbed minds with Dr. Gafar. And I told him that he has done the summary of summaries. So what we then do is to send it to you by email together with the presentations. Thank you.
Thank you, sir.
All right, good afternoon, everyone. So thank you very much for staying with us till the end. So you would agree with me that this event has actually enjoyed the participation of various groups of stakeholders from the CSO, lawmakers, policymakers, government officials. And a major take-home or a major thing that came out from this engagement is the need for a broad-based coalition, which I believe has been initiated from this conversation. So it is important that following these events, this momentum is actually sustained to ensure that we forge a consensus towards the acceleration of health policy design and implementation in Nigeria. And it's also important that we leverage this coalition to push for the SSB bill, which is the lowest hanging fruit for now. So on our part as DGI Consults, the valuable insights we've been able to gather from this discussion will be incorporated into the reports. So we'll have a final report that would also be disseminating to different groups of stakeholders using appropriate approaches. So thank you very much as we look forward to results from this conversation. Thank you.
Thank you, Sekinat. And finally, we'll take our vote of thanks, please, from Mrs. Kafayat Alawode, Program Coordinator at DGI Consults.
Good afternoon once again. So I would like to use this opportunity on behalf of DGI, the management and staff of DGI Consult, to thank all of you for honoring our invitation. So I want to especially thank the Alliance for Health Policy and System Research for finding us worthy of being contracted to conduct this research. Thank you very much for believing in us. And I also like to thank the Gatefield NASR National Nigeria UHC Forum, chaired by Chief Mrs. Wijima Konjiola, the HSRC chaired by Professor Lecky. I would also like to thank Professor Ladipo and Dr. Lola for all the support that you are giving to us. So thank you very much for the representatives, to the representatives of the Federal Ministry of Health, Federal Inland Revenue Services, the National Assembly, NPHCDA, the associations present here, the NASR, and the members of the NASR. Thanks so much for collaborating with us on this project. And I also thank the panelists who agreed to come to grace this event. And I would also like to thank Dr. Bola Paleye for all the support that LHSS has been giving us under her leadership. Dr. Obele, Dr. Akonde of USAID, Dr. Ibere, thank you very much for all you have done for DGI Consult. And thank you so much. I cannot mention everyone because the list is quite long. So thank you very much for the virtual audience, for the virtual participants and in-person participants. We appreciate all of you for honoring our invitation, and we hope that when we have subsequent events, you will also honor our invitation. Thank you so much and have a nice evening. Bye.
Enjoyed your presentation. Very well.
And the research team, please come forward for a group photograph, please. The research team. Thank you. Research team, please come forward for a group photograph.